right. Tristan?
Sure. Well, thank you all for coming. I know we said upon adjournment, but if you've been watching the council meeting, that's going to take a while. So we wanted to step out and give this update now. I'm going to turn it over to the 60th Mayor of Dallas, Eric Johnson.
Thank you, Tristan. Good afternoon, everyone. Appreciate you being here. I want to start off by saying this: wear a mask. This is the single most important thing that you can do to slow the spread of COVID-19. I know we all want to go back to normal and return to life as we knew it back in February. But COVID-19 is spreading rapidly in Dallas County. The data is clear. Our case numbers and our hospitalization numbers, which we've been tracking daily, are headed in the wrong direction. Tomorrow, we'll have a discussion with Dallas County and the Hospital Council about whether we need to stand up the K. Bailey Hutchison Convention Center medical facility. We're also working on plans to replace testing capacity after the federal government pulls its support for our community-based testing sites at the end of this month. We've been working hard with our partners, including the state, to provide more resources for the city of Dallas. And we're setting up additional neighborhood sites to provide more access to testing in our underserved communities. We currently have 2 such sites up and running. I will turn it over to Dr. Kelvin Baggett, our COVID-19 Health and Healthcare Access Czar, and Rocky Vaz, our city's Director of the Office of Emergency Management, to give you the details of those plans in just a moment. But before I do, I want to say this. These have been very trying times. Maybe you don't know anyone personally who's been affected by COVID-19. Maybe you're young and healthy, and you aren't all that afraid of this disease. The truth is, however, that people are dying and needlessly suffering. If we aren't careful, our healthcare system could be overwhelmed. We have to take precautions now or face potentially dire consequences. It's why we urge you to stay at home if you don't have to be out, and it's why a major part of Dallas Forward, which we announced yesterday, will be distributing donated PPE to small and medium-sized businesses. We have to look out for one another if we want this to end. The only way we're going to get through this pandemic is by being responsible. So let me end how I started, and let me say this once again: wear a mask. Thank you very much, and I'll now turn it over to Rocky Vaz.
Thank you, Mayor. So I'm going to repeat what the Mayor said: wear a mask. You see all of us doing that. So I want to pick up on where the Mayor talked about the federal support ending the end of this month. Now, we have known this for a while, but we continue to advocate. The Mayor did. Several of our elected officials, our delegation, continue to advocate. We still have 7 more days before the support ends. But preparing for that, we have been talking to many partners. We are working with vendors to have a seamless transition for testing at our 2 community-based sites. That will continue July 1st, and people will not see a difference on the level of service that we provide to continue to do the testing. We are also, and Dr. Baggett will talk about neighborhood testing sites. The Mayor said we have 2 neighborhood testing sites up and running for the last 10 days. And Mayor, we just added another site yesterday, the Vickery Meadows site. That's up and running. Additionally, Parkland also does mobile testing. They have 2 mobile vans that go and do up to 4 different sites a day. We will continue to do that. And as we continue through that process, we're going to look at additional sites that we'll bring online with several other partners that we have been working with that Dr. Baggett will talk about. Additionally, we are partnering with our state. The state has resources. The Texas National Guard has mobile units that come and provide testing. We started that process at Paul Quinn College 2 weeks ago, and we continue doing testing there on Tuesdays and Thursdays, and we are hoping we'll have 2 more sites in the coming weeks to announce that same process as we move forward. So with that, I'm going to pass it on to Dr. Baggett.
Well, thank you, Rocky. Thank you, Mayor Johnson. I'm just going to walk through a few slides, and just to provide a brief update, you'll hear many similar themes, as you should, as spoken by the mayor and also spoken as someone who I've become very closely connected to as well, which is Mr. Voss. And I really appreciate his partnership and my opportunity to contribute to the work that he's also leading on behalf of the city. So, one, we'll talk a little bit more about our testing strategy. Where are we? And then we'll talk about really our shared responsibility. This is a community issue that necessitates a community response. This does require us to consider our neighbors, and therefore that's what fed into our testing strategy and the way that we're deploying tests going forward and what we're calling our neighborhood testing strategy. So, as Mayor Johnson and Mr. Vaz were speaking to, we still have the community-based testing sites. Those are federally funded. That's the American Airlines Center, as well as Ellis Davis Fieldhouse. So we have those sites. We also have the mobile testing that Mr. Voss just spoke about, and our ability to have scheduled testing to be done for those who have limited or lack mobility. The third piece is what I want to speak a little more about, and that's our neighborhood testing. We recognized that there was a need to make testing not just more available in terms of the number of tests that we were offering, but also to make sure that testing was more accessible. So we went through a variety of criteria to better understand that. And we looked at where do we have the highest risk population, where do we see the highest number of cases, where are we also lacking in terms of available testing, and then how do we promote accessibility? How do we put a combination together that's not just drive-through, but is drive-through, that is mobile, and also walkable sites? And so, as Rocky mentioned, we have 2 sites that we've established, another that we've worked on in partnership that's been operational for a number of weeks, and we have several other locations that we're also considering as well. This is just to talk through some of those and give some visual demonstration of the options that we've created. Vickery Meadow is one that came online last week. What I would also say is that what we recognized was that it was not just about providing tests, but it was also about equipping people. If we were going to promote masks, which we are, recognizing that wearing masks is one of the proven preventive measures that should be taken, we wanted to also make every attempt and effort to make masks more available. So at each of these sites, at Vickery Meadow, at Paul Quinn College, we've not only provided necessary testing, but also worked with partnership with other organizations and the city to make masks available as well. And we intend to continue to do that as much as possible. A couple things in terms of the way we're thinking about this is, one, we've said no before you go. So before you go out in public, ask yourself, is it essential that I go? And if so, what might that environment look like for me? We want people to be mindful of this. We recognize that the highest incidence remains in those who are categorized as essential workers. And so it's important that we enable them to continue to go to work and minimize their risk. The second is to practice personal precautions. And that is the physical distancing, wearing a mask, and of course, hand hygiene. And the third is to monitor for symptoms. We want to make sure that people are mindful of the respiratory symptoms and the other symptoms that they may be demonstrating, and also take advantage of the testing that we have provided. Those are my comments, and with that, I will pause and turn it back to Mr. Hallman.
All right, we'll go ahead and open it up for questions. It looks like Jack maybe stepped out. David?
The DFW Hospital Council and the county, Dallas County.
The other is, I mean, obviously I can hear from your voice, and I've heard it before, just with the urgency, is there, I imagine at some point there's frustration, why you have this urgency, not really any regulatory power to do anything more than that.
What you're hearing in my voice, I think, is just a recognition that the situation is, the numbers are not moving in the right direction, and it's just becoming increasingly clear that we are not doing a great job on wearing masks and doing the things that we need to do, and we have to turn this around now. It can't continue to be politicized, this issue of wearing masks. Everyone up here is wearing a mask. Everywhere I go in this city, I want to see people wearing masks. It's just that simple. It's what we have to do to keep these numbers from going further in the wrong direction and potentially overwhelming our healthcare system. So that's what's on my mind. It's what keeps me up at night. I want to see us beat this thing, but it's going to take wearing masks until we get a vaccine. That's just what it boils down to. Because there's a lag in when, and I'll let the good doctor and Rocky speak to this as well, but there's a lag in the data when you see the actual uptick in hospitalizations. It's showing you what that's the result of things that happened 2 weeks prior, say. So what we're seeing right now is a result of 2 weeks ago. So we're looking 2 weeks out, and we just want to make sure, that if these cases continue to move in the direction that they're moving right now, which is 400-ish new positive cases a day, we want to make sure that we are not in a position where we don't have the hospital beds and ventilators to take care of our people. So we are meeting tomorrow to really make sure we have our arms around where we are on hospital capacity. That's why we want the hospital council there and the counties there, because we are partnering with them to make sure that the K. Bailey Hutchison Convention Center could be stood up if we need it. And so that's what we're doing. We're trying to stay ahead of this thing. We don't want to be in a position of reacting. We want to be proactive. And it's just, again, the numbers are moving in the wrong direction, and we want to make sure that we are prepared for what could be happening 2 weeks from now. So that's why we're meeting tomorrow.
Rocky, Dr. Baggett, do you want to add anything to that?
I just want to add one thing and echo what the mayor said, 2 weeks lag time. And our purpose of meeting is to make sure that we can stand it up. We never stood up that federal medical station. We had everything ready, so it takes 7 to 10 days to fully stand that up with all the wraparound services and the medical personnel. Also, the other thing is, when we first looked at it 2.5 months ago, the need was different. We need to, again, talk to the hospital, the CMOs and CEOs on what the need might be if we have to stand that up and what that model will look like, and be prepared for that. And that's the reason we're meeting again tomorrow.
Dr. Baggett, anything else?
No, I think it's very well stated. I mean, we do know that there is a lag. We do know that preparation is necessary. We fortunately have had ongoing dialogue with our hospitals, including the hospital council, to understand where they are today and what adjustments might be necessary. But I think that's why it's even more important, given the numbers that we're seeing, to have this conversation now, recognizing that, as Mayor Johnson continues to reiterate today and continues to remind us, is that it's heading in the wrong direction, and we've got to make sure that we're ready with whatever countermeasures might allow us to respond to it.
All right. Any other questions, guys? Yep.
You want to repeat the
Sure. The question was whether there's anything that can be done at the county or municipal level under the governor's orders, and I think referring to the fact that we could restrict outdoor gatherings to 100 or fewer people. I know that I believe that Dallas County is looking at that currently. They, of course, supersede us, so what we've been doing, not since the beginning, but early on, kind of just to make sure that everything was the same across the board in the city, is have the county sort of take the lead on the language and then adopt it into the city's orders so that it's applied citywide. But I think that's, I don't want to speak for the mayor here. I guess I will, but I think any tool that's in the toolbox that can be used is something that's definitely going to be looked at by either us or the county or both.
Yeah, that's basically right. We're looking at it at the city and county level to see whether or not it makes sense for us to do that. It's clear to us now that's permissible, so we're looking at it.
All right. Well, thank you very much for coming to the David Goins show there. Well, let us know if you have any other questions, and thanks again for coming.